What if your dental plan allows for 2 cleanings a year and you only got 1, right? Why throw away money if you have another cleaning coming? You should take advantage of some of the preventive care offered by your dental plan. What if you have money left over in your flex spending account? You know, that money is taken out before taxes. And if you don't use it, you can lose it. So, here with me, Dr. Jim Craig from Summerbrook Dental. They can fit you in before the end of the year. What a great practice. 2 young men working diligently to help people who are especially afraid of dentists. It's such a comforting place. And they do sedation dentistry. I think that's their claim to fame because they have all kinds of ways to make you comfortable.
Yeah,
talk about that first, and we can talk about taking advantage of these plans.
Yeah. Well, a lot of people, as you know, Tom, are really afraid of going to the dentist or have had a bad experience in the past. And for those patients, we have a very caring, gentle, easygoing environment where you're not pressured. And if you need any work done, then you have the option of actually sleeping through your appointment, having it all done at once, waking up at home or waking up in our office even after the procedure, and it's all finished.
Now, and what you can do is you can give them any amount of sedation. They can be just mildly sedated.
That's right.
Maybe just a tranquilizer. They can do some what they traditionally call the laughing gas. Or a combination.
Yeah, we can.
And we've had people come here and with you to talk about extraordinary things they had done. And they said, oh, it was wonderful. I was so afraid. And it's just over.
It's just over. You have no passage of time. You wake up, your procedures are done.
That's what I like.
Yeah.
And you know, people mention you, and you're very comforting.
Good.
And sometimes when you walk in, they say, "Where's your father?" Right?
That's right.
You're just a young person. I'm not. Look, I know you have experience. I know you do a great job, or you wouldn't be on the show. But people really are taken aback by you because you and your partner are both kind of young, and you're laid back. And I love that environment. That's what people mention even before the sedation. They feel different about your office.
Yeah, well, I hope so.
You hear that all the time, don't you?
We do. We get that a lot. And you're right. I joke with my patients and say, I'm not that young. I'll be 16 next month. But I have 4 kids. So does my partner. We've been doing this for a while.
Just call me Doogie Howser. Now, we cater to cowards, but not just cowards. I mean, you have a full dentistry, a full service dentistry, and I don't want people thinking, oh, I have a dentist, I go all the time, I don't care. Well, we're not talking to go just for sedation. We're talking about good general dentistry. Yeah. And some of the things you do, you really do a lot of things. You, first of all, you have general dentistry. Don't you even do, am I right in saying you do root canals there?
We do. We do root canals.
And that's extremely important in itself. So you can do everything under one roof.
All in one house. Yeah, that's right.
And you have what's called Invisalign. Explain what Invisalign is for those of us who had crooked teeth or wanted to straighten out teeth. What is it?
Invisalign is a way to straighten your teeth without the painful brackets, without the unsightly wires, and in a shorter amount of time usually.
In a very short amount of time. And do mostly adults kind of go toward that, the ones who wish they did it earlier in life?
We do.
And they're working and they want to kind of cover it up? Yeah,
or they've noticed the tooth has started to get crooked in their smile and it's just gotten worse over time. We have 2 patients who are in their 80s in Invisalign, so it's never too late.
Really? Yeah. And that's a good point you bring up. Even if you have relatively straight teeth, they can change with age. Why is that?
Well, our bodies change with age. Our bone structure changes, our bite can change even, and sometimes a little space can open wider and wider over time.
So you can see that trend and kind of stop it.
We can, we can stop it.
And by the way, with Invisalign, and you'll see this at the end of the segment, but he's offering a free consultation for Invisalign.
That's right.
That's a full complimentary consultation. Plus, I may as well just tell you right now, $300 off the purchase, which is incredible. How long does this treatment usually take with Invisalign?
About 6 months usually. Most of our cases are about 6-month cases, sometimes less.
And you do 2-year interest-free financing?
We do, yeah. It's Invisalign is like braces. It can be a little pricey, and so we want to make sure it's affordable. Now,
talk about your practice, because I really like you guys. I like the way you do business, the way you treat people. You do treat them like guests. I mean, you treat them like friends. It's not sterile. It's just not scary.
No, we try to feel like home.
You have 2 full-time dentists.
We do. 2 full-time dentists. And what do you need?
Is your colleague afraid to come on TV?
No, he's not. I need to bring him on.
You gotta. Okay.
You see the patients. No, he's fine.
And you have people from. You do children, and that's important. So the whole family.
Yeah.
And children, that's a specialty unto itself. You do children.
Yeah.
You have patients up to 100 years old.
Oh, sure, yeah.
And you've been in practice, well, the business was 30 years. You took this practice over.
That's right.
Now,
yep.
was it a relative, or did you guys buy the practice?
No, bought the practice from a guy who had done a fantastic job before
Was he
us.
into the same kind of family practice that you have?
Oh, very much. Very caring, very much.
And I've said this before, and boy, did I get a lot of bad press over it. I mentioned something about dentists sometimes. They're good at dentistry, but they don't know customer service, or they don't know the business end. And that used to be the case with a lot of dentists.
It did.
And you like the idea that you guys cater to customer service.
Yeah, I kind of see my job
that?
as just showing you what you can have done, and then the patient's job is to let us know if that's what they really want and how fast they want to go. You don't have to be pressured.
And to make people happy. I mean, you're not just always right,
yeah,
even if
right.
you're the dentist.
Oh, right. There are always options.
And that's what I like on a consumer show, is someone who recognizes that even though you do excellent dentistry, you may not do something they want, or you might have to do something for someone that you might feel, well, you know what, I thought I did enough.
Yeah.
And instead of fighting with them, I noticed that you just have the attitude that we want to make people happy.
Sure, it's their mouth. It's not my mouth, so I don't want to say, you have to do this. We'll give you the options.
Let's talk about insurance. It's very important.
Yeah.
Now, toward the end of the year, explain it. And you take insurance?
We do. We take a lot of insurance. And most people don't realize or don't know that their insurance benefits are going to expire December 31st. Now, this comes out of your paycheck every month.
Right.
So if you have a tooth that's crooked, or a color that you don't like, or you just need a cleaning and you haven't gotten it yet, now's the time.
Or you start your deductible all over again in some cases, right?
Yeah,
and then, again, if you have flex spending, that can be used for dentistry.
It can, yeah.
Now, I want to mention this because this is good. You can usually schedule the same week that you call.
Oh, yeah, sometimes even the same day, sure.
Even the same day sometimes.
Yeah.
So here are the specials you really need to know about these two special offers. First of all, a free bleaching tray, or free bleaching trays that's upper and lower with exam and cleaning. And explain that the bleaching tray is something you can take with you and whiten your teeth.
It is. It's something you can take with you and use forever.
Yes.
It's not a one-time use thing, and we give you enough gel to last you a couple of years.
Right. So every few months you may want to do this, and you'll have the trays for you as a result of this exam and cleaning. And what about the exam and cleaning? Does it include digital x-rays?
It does, yeah. It includes a full set of digital x-rays, and we'll do the cleaning for you also.
And digital x-rays are much less intrusive than the old-fashioned ones. You don't get as much radiation. It's a great way to go. Also, listen to this. Is this for sure still on? Free x-ray, free exam, and free consultation. People, that means you go into Summerbrook and you see Dr. Craig, and if you don't want to use them, I don't know why you wouldn't, you don't have to, but they will give you a complete examination along with x-rays and consultations. That itself is incredible. So if you've been putting off seeing a dentist, please go 303-693-1215, 303-693-1215. On the web, it's summerbrookdental.com, summerbrookdental.com, and you can see our segments on martino.tv.